Hi, this is Dr. Silvester, and I'm going to talk to you a little bit today about why I think you should come to see us if you have a diabetic foot ulcer. I had an experience I think it's 2 months ago, when a gentleman came to see me, and he had been to a wound care center for about a month and a half, and he had been seeing another podiatrist for about a month, and he had been told that he needs to get a first toe amputation because they were afraid that he had a bone infection. Well, the patient comes in to see me, and it may be that he has a bone infection. They're difficult to diagnose in some cases, and we put him on a treatment therapy, but one of the primary treatments we put him on was getting pressure off the wound. The mistake that I see that most wound care centers, and quite frankly most other doctors make, is that they are treating a wound. The problem with treating the wound is that the wound is not the problem. The wound is a problem, but the problem is the pressure caused by some other biomechanical function or by some bone putting pressure down on the area where the ulcer is that's causing the ulcer. So this gentleman had that condition, and so we put him in a cast that took pressure off the wound, and almost immediately all the redness went away and it began to shrink. We also gave him some IV antibiotics, and if he did have a bone infection, fortunately we were able to clear it up. Subsequent to that, as soon as the patient got the cellulitis or the infection signs down and he just had a simple, healthy-looking ulcer on his foot, we didn't let him return to shoes. We didn't let him go back and put pressure on the foot the same way and cause the same problem again. We immediately took him to surgery because he was a stable diabetic. He wasn't any big risk of doing surgery on him. And we fixed the two components that were putting pressure on the ulcer. There were two different issues that he had, and we fixed them both at the same time. The patient went through the recovery with no problem and was able to get back in shoes, and the foot stayed closed. The other patient that we see quite frequently is a patient who's had a diabetic foot ulcer, goes through all this elaborate, expensive wound care, gets the wound healed, and then 3 weeks later, as soon as he returns to his normal shoes, the ulcer starts coming back. And that's because they're not addressing the cause of the problem. It's like having a flat tire. If you have a flat tire, the most important thing is to fix the leak. If you don't fix the leak and just keep putting air in the tire, it's going to be an ongoing problem. And so that's why I think it's important for people, if they have a diabetic foot ulcer, to consider seeing us so that we can address the cause of the ulcer initially, and thereby hopefully prevent future breakdown and ongoing problems and difficulty in healing the wounds. For example, in this gentleman who'd had a wound for 6 months, within a week after he had his surgery, his wound closed completely, and it hasn't opened up since. So that's something to consider. I appreciate you listening. Thank you.